Bismillahirrahmanirrahim. Quote of the day: education is the most powerful weapon which you can use to change the world. I am Dr. Alishba Rasool, and today the topic of my presentation is essential drugs, disinfectants, and I will be presenting it under the kind supervision of Professor Dr. Saira Afzal. Learning outlines, essential drugs, classification of drugs, disinfectant classes, properties of an ideal disinfectant, eco-friendly disinfectant, uses of chlorine for disinfection, hospital disinfection, recent updates and MCQs. Learning objectives. At the end of the presentation, participants would be able to describe the essential drugs and their classification, properties of disinfectant, and would be able to answer the MCQ session. Essential medicines intended to be available within the context of functioning health systems at all times, in adequate amounts, in appropriate dosage, with the assured quality, and at a price that the individual and community can afford. Access has been defined as having medicines continuously available and affordable at public and private health facilities. Quality is represented by the absence of the expired stock on pharmacy shelves and adequate handling and conservation conditions. Rational use is measured by examining, prescribing, and dispensing practices, standard treatment guidelines, and the essential medicine list. It is recommended that the all service collect at a minimum data on global list of 14 medicines included in the WHO HAI surveys and preferably 16 regionally specific medicines. In addition, countries are encouraged to collect data on further 20 medicines of national importance. It is recommended that a national survey of medicine prices and availability be conducted every 3 to 5 years using WHO standard methodology. What is essential drug list? Those that fulfill the priority health needs of majority population, they should therefore be available at all times in adequate amounts and appropriate dosage forms and at a price that the individuals and community can afford. The first essential medicine list of Pakistan was prepared in 1994 and the last list was updated in 2016, containing medicines classified for use at primary, secondary, and tertiary setups. Determination of the list of essential drugs should be based on morbidity patterns, seasonal trends, sickness load, level of healthcare service, and competency of health manpower. The common can be ORS packets, anti-malarials, painkiller, antipyretics, antibiotics, bronchodilators, eye ointment, anti-snake venom, vaccines as per EPI, oral contraceptive pills, antiseptics, and bandages. What is hospital formulary? List of available medicines in the hospital. No hospital pharmacy can stock every medicine that the doctors may want to prescribe. Therefore, pharmacy staff of the hospital make up a hospital formulary, which is a list of medication that the hospital pharmacy stocks, along with the information about each medicine. The committee that compiles the hospital pharmacy meets regularly to make changes as necessary. Doctors use the formulary to find out which medications the hospital has available to treat a given symptom or condition. Classification of drugs: oral drugs, injectables, infusion fluid, vaccines, immunoglobulins, and anti-sera, drugs for external use and antiseptics, disinfectants. Disinfectants classes: natural agents, sunlight and airing, physical agents, incineration, hot air, boiling, autoclaving, ionizing, and radiation. Third are the chemical agents. Chemical agents: phenol and related compounds, quaternary ammonia compounds, halogens and their compounds, alcohols, formaldehyde, lime, and ethylene oxide. Properties of an ideal disinfectant: broad spectrum, wide antimicrobial spectrum. Fast acting, should produce a rapid kill. Remains wet, meet listed kill contacts with a single spectrum. Not affected by environmental factors, active in the presence of organic matter. Non-toxic, non-irritating to user. Surface compatibility, should not corrode instruments and metallic surfaces. Persistence should have sustained antimicrobial activity, easy to use, acceptable odor, economical, cost should not be high, soluble in water and stable in concentrate and use dilution, cleaner, good cleaning properties and non-flammable. Resistance to disinfectants has also been developed. Shown below is the order of resistance of microorganisms from the most resistant to most susceptible. Prions, spores, mycobacteria, non-enveloped fungi, bacteria, and enveloped virus. Eco-friendly disinfectant. Silver nanoparticles have been shown by many researchers to be a very safe and highly effective disinfectant. It is also available in Pakistan. Its applications are in industry, biomedical, and environmental. Now, this is the comparison between the eco-friendly Virex Silver nanotechnology and the conventional disinfectants. Protection kills all the bacteria, viruses, mold, and fungi, works immediately, continuously, and kills bad odor. Conventional disinfectants, on the other hand, are limited availability to kill the bacteria, viruses, germs, mold, and fungi. Only works until alcohol evaporates, cover up bad odors. Smell, these are the odorless, while the conventional disinfectants have strong chemical smell. Longevity up for up to 30 days, evaporates after a short time. Cost, silver nanotechnology reduces labor and cost for frequent disinfecting. Conventional disinfectants need daily, weekly manual labor and expensive disinfectants. Application can reach every corner and other hard to protect areas, works right away after application, can be applied to all surfaces, including textile and fabrics. Fast application once a month, uses misting to meticulously distribute protective layering to all surfaces, electrostatically wraps around objects. Conventional disinfectants difficult to reach at all surfaces, takes 10 to 15 minutes to work efficiently, limited to surfaces, daily to weekly cleaning and disinfection, only targets front-facing surfaces. Safety, non-toxic, non-dissolving, non-volatile, harmless. Conventional disinfectants are highly flammable, dangerous to human health, dangerous around food, can cause skin irritation. It is eco-friendly, the silver nanotechnology, while the conventional disinfectants uses chemical and toxins that can be harmful to the environment. Disinfectant for COVID-19. As COVID-19 is a lipid-containing virus, it can be killed with wipes. Copper surfaces tend to kill the virus in 4 hours, while the disinfecting surface with 62 to 70% alcohol or 5% hydrogen peroxide bleach kills virus within a minute. Frequency of disinfection should be according to the viability, which is different for different materials. SARS-CoV is usually stable at higher temperatures. In a research, it was seen that only when samples were heated for 15 minutes at 92 degrees Celsius did the virus die. Uses of chlorine for disinfection. In general, chlorine solutions of different concentrations are commonly used as disinfectant as it has bactericidal, tuberculocidal, and fungicidal activity. It is also active against viruses like Hep B and Hep C and HIV, and also it has sporicidal activity. It is used for water treatment, surface disinfection, instruments and linen, etc. How to prepare a bleach solution? Two different dilutions of bleach are used for disinfection. 1 to 10 bleach solution for disinfecting excreta, spills of bloody body fluids, vehicles, tires also used to prepare 1 ratio 100 bleach solution. 1 ratio 100 bleach solution for disinfecting surfaces, medical equipment, bedding, reusable protective clothing before it is laundered. Also recommended for rinsing gloves between contact with different patients. To prepare 1 ratio 10 bleach solution, add 1 volume of household bleach to 9 volumes of clean water. To prepare 1 ratio 100 bleach solution, add 1 volume of 1 ratio 10 bleach solution to 9 volumes of clean water. Household bleach is a solution of sodium hypochlorite which generally contains 5% available chlorine, also known by other names such as Clorox. Chlorine solutions gradually lose strength, and freshly diluted solution must therefore be prepared daily. Clean water should be used because organic matter destroys chlorine. 1 ratio 10 bleach solution is causatic. Avoid direct contact with skin and eyes. Bleach solution gives off chlorine. Prepare them in a well-ventilated area. Use plastic containers for mixing and storing bleach solution as metal containers are corroded rapidly and also affect bleach. The principal means for disinfecting hands is by washing with soap and water. If available, commercial hand disinfectant containing alcohol, chlorhexidine, or From iodine could be used. Use of strong chlorine solution should be avoided as it is dangerous. The figure shows how to make strong 0.5% chlorine solution from liquid bleach. Hospital disinfection, sterilization for critical items that will enter tissue or vascular system or blood will flow through them. Disinfection is for semi or non-critical items. It has following types: high level disinfection, intermediate level disinfection, and low level disinfection. High level disinfection disinfects semi-critical items that come in contact with mucous membrane or non-intact skin with glutaraldehyde based formulation, hydrogen peroxide, hypochlorite, ortho aldehyde. Pasteurization may be an alternative to high-level disinfection. Exposure time of disinfection is 12 to 30 minutes, greater than 20 degrees Celsius. High-level disinfection is used for endoscopes, ETT, anesthesia, breathing circuits, and respiratory therapy equipment that touch either mucous membranes or non-intact skin. Intermediate and low-level disinfection. Intermediate is not much used in hospital and is for semi-critical items and non-critical items. Low level is for critical items that will come in contact with intact skin. Both done with ethyl or isopropyl alcohol, sodium hypochlorite, phenolic germicidal detergent, iodophor germicidal detergent. Exposure time greater than 1 minute. Now it's time for latest updates. Alcohol-free hand sanitizer and other quaternary ammonium disinfectants quickly and effectively inactivate SARS-CoV. SARS-CoV is the virus responsible for the current global pandemic, COVID-19. Because this virus is novel, little is known about its sensitivity to disinfection. We performed suspension tests against SARS using 3 commercially available quaternary ammonium compound disinfectants and 1 laboratory-made 0.2% benzyl chromium chloride solution. 3 of the 4 formulations completely inactivated the virus within 15 seconds of contact, even in the presence of a soil load or even when diluted in hot water. Quartz rapidly inactivate the SARS-CoV-19 virus, making them potentially useful for controlling SARS-CoV spread in hospitals and the community. The role of disinfectants and sanitizers during COVID-19 pandemic, advantages and deleterious effects on human and the environment. Disinfectants and sanitizers are essential preventive agents against the SARS-CoV-19 virus. However, the pandemic crisis was marred by undue hype, which led to the indiscriminate use of disinfectants and sanitizers. Despite demonstrating a beneficial role in the control and prevention, there are crucial concerns regarding the large-scale use of disinfectants and sanitizers, including the side effects on human and animal health, along with harmful impacts treated on the environment and ecological balance. This article discusses the roles of disinfectants and sanitizers in control and prevention and highlights updated disinfection techniques against severe acute respiratory syndrome, coronavirus 2. The article provides evidence of the deleterious effects of disinfectants and sanitizers exerted on the human, animals, and environment, as well as suggested mitigation strategies to reduce these effects. Additionally, potentially technologies and approaches for the reduction of these effects and the development of safe, affordable, and effective disinfectants are discussed, particularly eco-friendly technologies using nanotechnology and nanomedicine. Now it's time for the MCQ session. It has been observed that resistance to disinfectants has been developed. Which one of the following microorganisms shows the most resistant to a disinfectant? A. Spores, B. Mycobacteria, C. Fungi, D. Prions, E. Non-enveloped virus. It's D. Prions. Conventional disinfectants use chemical and toxins that can be harmful for the environment. Which of the following is an eco-friendly disinfectant which is also very effective? A. Phenol, B. Sunlight, C. Lime, D. Ethylene oxide, E. Virex silver nanotechnology. It's E. Virex silver nanotechnology. Which of the following kind of disinfection is used for endoscopes, ETT, anesthesia, breathing circuits, and respiratory therapy equipment that touch either mucous membrane or non-intact skin? A. Intermediate, B. High, C. Low-level disinfection, D. Sterilization, or it's E. Pasteurization. The correct answer is B, high level disinfection. No hospital pharmacy can stock every medicine that the doctors may want to prescribe. List of the available medicine in the hospital is known as A. Pharmacy, B. Dispensary, C. Hospital formulary, D. Essential drug list, or E. Disinfectants. It's C. Hospital formulary. Medicines intended to be available within the context of the functioning health systems at all times in adequate amounts, in appropriate dosage, are called essential medicines. How can you assure their rational use? Medicines continuously available, assessing their affordability, absence of the expired stock on pharmacy shelves, adequate handling and conservation conditions, examining, prescribing, and dispensing practices, standard treatment guidelines, and the essential medicine list. It's E, examining, prescribing, and dispensing practices, standard treatment guidelines, and the essential medicine list. The first essential medicine list of Pakistan was prepared in 1994, last updated in 2016, containing medicines classified for use at primary, secondary, and tertiary. How are these determined? Based on seasonal trends, based on morbidity patterns, based on morbidity patterns, seasonal trends, sickness load, level of healthcare service, competency of health manpower, based on competency of health manpower, E based on sickness load. C, based on morbidity patterns, seasonal trends, sickness load, level of healthcare, and competency of health manpower. COVID-19 is a lipid-containing virus and it can be killed with bites. Frequency of the disinfection should be according to the viability, which is different for different materials. Disinfecting surface with 62 to 71% alcohol or 5% hydrogen peroxide bleach kills the virus within A minute, B a day, C 2 days, D 4 hours, E 24 hours. It's A minute. The longevity of the silver nanoparticle eco-friendly disinfectant as compared to the conventional disinfectant is A, evaporates after a short while, B, lasts up to a day, C, lasts up to 30 days, D, lasts up to a week, E, lasts for a... The correct answer is C, lasts up to 30 days. In general, chlorine solutions of different concentrations are commonly used as disinfectant. To prepare a 1:10 bleach solution, you will have to add 1 volume of household bleach to 9 volumes of clean water, add 1 volume of clean water to 9 volumes of bleach, add 2 volumes of clean water to 8 volumes of household bleach, add 8 volumes of clean water to 2 volumes of household bleach, add 6 volumes of household bleach to 4 volumes of clean water. The correct answer is A. We add 1 volume of household bleach to 9 volumes of clean water. A disinfectant is used to destroy the bacteria and germs. Which of the following disinfecting technique is used in the hospital for critical items that will enter the tissue or vascular system or blood will flow through them? High-level disinfection, low-level disinfection, intermediate-level disinfection, sterilization, or E, both low and intermediate level. It's de-sterilization. This is the key of my MCQs. Thank you everyone for your patient listening. Allah Hafiz.